Hi there, I'm Dr. Brigid Norton. You can call me Brigid. This is Menopause Bytes, where I unravel the mysteries of menopause for you in bite-sized episodes. Today, we're going to be tackling the precise definition of menopause and how to know if you're menopausal. So let's get down to basics. The way that I think about menopause is that the ovaries are completely wrung dry. No more eggs, therefore no more hormones, at least estrogen and progesterone, from the ovaries. The actual clinical definition of menopause, though, is 1 year of no bleeding. That's it, 1 year of no bleeding. Clearly, this is not a perfect definition, and it obviously does not fit every woman, including if you've had a hysterectomy or had your uterus removed or are on some hormonal birth control options like the Mirena IUD, where you may not get your period at all, or you're taking the birth control pill continuously, purposefully skipping periods. However, it is the definition that we have. And to make matters worse, we don't have a straightforward or definitive test to confirm menopause or predict its onset. If there was such a test, trust me, I'd have run it on myself so many times over the years. You might assume that hormone testing would confirm menopause, but it's actually much more complicated than that. Hormone testing has limited usefulness for various reasons, and it rarely influences what we recommend. Our primary focus is always on treating symptoms, not on treating hormone levels. I will devote another episode of Menopause Bytes to hormone testing. In terms of predicting when your last period will be, the best that we can say is if your periods are skipping every 60 days or so, then your last period is probably 3 to 4 years away. Super helpful, I know. And you are much less likely to follow in your mother's menopausal footsteps in terms of menopause timing compared to your sisters. If you have older sisters, you are more likely to follow in their footsteps. So what else do we know about menopause timing? Well, in the US and Australia, the average age that women stop their periods is 51 to 52. That means that 50% of women are done by that age, 50% are not. 90% are done by age 55, 10% still getting periods after the age of 55. And then when you look at the normal range for when most women stop their period, it's anywhere from 40 to 58, which I know is a really large range. Now, if you stop your period before the age of 40, that's called Premature Ovarian Insufficiency, or POI. We tend to do much more testing in this circumstance because there are a lot of health risks associated with premature ovarian insufficiency, including heart disease, bone loss, and dementia. If you stop your period between 40 and 45, it's called early menopause. While this is actually in the normal range, it is also associated with some health risks like heart disease and stroke. So we do tend to do some additional testing on you as well. Of course, what we've been talking about is natural menopause, but menopause can be caused by certain medications like chemotherapy or caused by surgery, specifically when we remove both ovaries. This type of menopause tends to be much more abrupt and have much more severe symptoms associated with it. So if there's no test that will tell you when you are menopausal, and there isn't, then how do you know where you are in the process? Well, that's a great question, and the answer is actually pretty simple. If you're over the age of 45 and haven't had your period for a year, then you are most likely menopausal. If you stop your period for a year before the age of 45, we will run some tests to figure out what's going on, but you could certainly be menopausal. And since perimenopause is the 8 to 10 years prior to stopping your period, if you're in your 40s, you are probably perimenopausal or close to being so. Reaching that important milestone of 1 year of no bleeding is significant because it means you don't have to be concerned about pregnancy or unpredictable periods, but it doesn't mean freedom from the other symptoms that are so bothersome, like hot flashes and night sweats. These symptoms often begin during perimenopause, and unfortunately, they can continue even after you are officially menopausal or have reached that 1 year of no bleeding. Okay, so that's it for this episode of Menopause Bytes. Here are some takeaway bites to remember. Menopause means that your ovaries are wrung dry with no more eggs and therefore no more estrogen and progesterone. The actual clinical definition of menopause, though, is 1 year of no bleeding after the age of 40, and there is no definitive test for that. Until next time, may your hot flashes be bearable, your nights restful, and may your glasses be easy to find.